Hello and good evening to tonight's show of Healthy Vision. I am your host, Lady Nay, and I'm so excited to be here with you guys for another episode. We're going to talk about everything that pertains to eye care and vision health. We want to make sure that you learn from this episode and that you're able to share information with others that you know that may be having visual problems, visual impairment, or maybe you just want to practice prevention so that you will not have problems with your vision. So welcome to the show and thanks for tuning in. We are celebrating the month of November. And November has a lot of different focuses for us to concentrate on. There are a lot of things that we're going to bring awareness to, we're going to highlight for you, and please remember to share with people that you know. So one of the things that we focus on in November is Alzheimer's disease. During this time, we take a moment to read on the research and really learn about what the disease is, how it affects people, who it affects, and how to practice prevention. So Alzheimer's is a disease that affects your memory and your awareness, your cognition. And so people usually develop that disease later on in life, and they kind of get disconnected from friends, family, and loved ones until they lose their memory and the body basically stops functioning. So this is something that affects a lot of Americans and a lot of people everywhere. So take some time to do some research on Alzheimer's disease, because November is a month for Alzheimer's disease awareness. Before I go any farther, I would like to also welcome Dr. Prince, who's going to be with us and going to be discussing a lot of these different topics. Thank you so much for having me tonight. How are you feeling?
I say thank you for having you. Thank you for having me tonight. And we say the good evening or good morning to anyone watching the network tonight. And as you can hear from Lady Nay, November is a lot of things this month based on your specialty, based on what you do for living. We're in the healthcare system. We're going to talk about healthcare. We're on the vision. We're going to talk about vision. But don't be surprised if you are a journalism, or if you're an attorney, if you're whatever your profession, there is a lot going on in November.
Sure.
Yeah.
So another thing that we emphasize in November is Bladder Health Awareness Month. And you know, it's something that maybe people wouldn't think is a big deal, but bladder function is very, it's an indication of things that may be going on in the body.
You said people may think it's not a big deal?
They might think like, oh, bladder.
Because you never see, when we talk about bladder issue, and we are not going to in detail with it, because this is not the scope of practice, because it will be nice to have a urologist and here or gynecologist that specialize in this area that can be here. Hopefully in some of this show during November we can have one of these guests that can come in. But so many people usually cannot hold the urine, you know, stuff like that. So many people are taking medication. So many people doesn't know what to do. So many people after the pregnancy, they have this type of issue.
Yes.
You know, so many men, you know, based on if they have any prostatic issues, stuff like that, not only they cannot hold urine, but they keep going very often. Some of them, if the urine pee cannot even go out. We're not going to stay in detail, because I like the way you approach the beginning of the show is dementia, but this is the way you approach it. But this is a big topic in the United States, because it's an old age country. A lot of people have memory issues, stuff like that.
Exactly, because the bladder symptoms may be a sign of something else that's going on in the body. So definitely. So we also have COPD awareness, which is basically like a breathing complication, right?
Yes, the COPD most likely is a, like you said, is a is a type of lung disease. Most likely, a lot of people that have that's the smoker, stuff like that, that have some form of bronchitis that not get treated, or people that have any form of lung issue that get complicated, and they can get COPD. But this is the time, for this month. And we are not, because we are low vision place, we are not going to talk a lot about it. But people that smoke, this is the time to look yourself in the mirror.
Yes.
And if you see you cannot breathe, and ask yourself a lot of questions, why you doing that to yourself? Or if your doctor keep asking you to quit, because smoking is not only causing lung disease, it can affect your vision, it can affect everything, stuff like that. This is the month you're going to see a lot on TV as for smoking, because there is a lot of non-profit organization and like us, that do awareness, that advise people to quit smoking, second-hand smoking, stuff like that. And because they try to prevent you to have this kind of complication, because when you have this, your heart can be affected, you can have all kind of issue.
And actually, one of our very important national icons, which is Maya Angelou. She was a very famous poet. She was an activist, and she spoke up for women's rights. She spoke up for equal rights in terms of race relations. And she, was smoking in her younger days. Well, in her older days, she died due to complications of COPD.
Yeah, that's so sad, but it's easy to say to quit smoking. I know it's not easy. I know I have a lot of patients coming here to the press center. The wife is advising them to do it, but a lot of these patients, sometimes they just stay one day, they see all blood it is like they see their eyes all red, but they don't know where that come from. A lot of these things related with the smoking, but that's part of the eye with so many complications. You see the example you just alive. That's mean any organization, any people that focus on this, any healthcare professional, because the network is open for them too. If they want to use for the November, have a message they want to lay out, or just to communicate with the PCVI network, stuff like that, we open. They can always contact us, because they can get Lady Nate, they can let the PDG of the radio, and when a Leon, stuff like they can get everyone to get it.
Well, that's a very generous offer from you. Thank you very much. So all you healthcare professionals, not only with vision, but also with like lung care, pulmonary specialists, breathing specialists, you can reach out to the station, and we'll definitely find a way that we can work together. November also highlights Family Caregivers Month, okay? And I know about that firsthand, being a caregiver, because my grandmother had a stroke when I was 10 years old. And because of the stroke, she had diabetes, she had high blood pressure, she could not live on her own. Thank God she had us. And we were always responsible for what she ate after her stroke, making sure that she didn't have foods that were too sweet, foods that had too much sodium in them. And that was a very, it shaped my life a lot. It was a very intense experience.
That's good. That's good you live that experience. But most likely, but I have almost the same experience like you. Maybe my work was because my mom had 2 stroke. For a lot of people that know me, they know I really care about my mom, and she was with me, and we do what we're supposed to do.
Yes.
And this is something, we're born, and when our parents get old, at some point we have to take care of them. We do what we need to do. But there is a lot of, because this country is an old age country where people live longer. There is a lot of nursing home. There is a lot of assisted living facility. There is a lot of people now too that instead of getting agency, instead of getting people from outside to take care of their parent, they decide to take care of the parent to what they call the CDPAP program. You know, well, they can get paid, I understand that, but they take care of the parent, because what this brings also to the table, because a lot of research prove that when these people, they are the ones that take care of the parent, these people went back to the hospital less. You know,
Okay.
it's nothing against the nursing home, it's nothing against the assisted living facility, but this is a fact. But this month, this is a month, most likely, we're going to get in touch with some of the home care agency, because we have one that already contact us, that advise us if we can, you know, if they
Work
can have a
together.
nurse come in during this month, because this is their month to use that platform to educate people, you know, as for how to take care, not only the family. When we talk about family, your caregiver is your family, because I see all the home health aid when they come with the patient at the center with people who visually impaired. Usually, the people they say it's like this person is my daughter. You understand?
Yes, sure.
And it's really good. But we at the Prince Center, we're going to use this platform for ourselves to educate a lot of people that take care of the parent, specifically the one that visually impaired, that lost the vision, the best way to communicate with them, the best way to help them with adaptation, stuff like that. We're going to use this one to do all these things in our area. But
Yes.
for the other part, we know you're going to get a lot from your job. Your job going to tell you this, the stuff like that. We're going to leave it for a lot of it. But that's good. You live that experience.
Yes, because you know, you mentioned that people who are cared for by loved ones at home, they go to the hospital a lot less. That's because there's no place like home. You know, you want to be home, c'est là à l'aise, you're comfortable there, and there's nothing like being at home, the comfort and the ease that you get. But I think also one thing for us to keep in mind also is that not only do we want to focus on the patient, we want to focus on the caregiver.
Yes.
Because the caregiver neglects themselves sometimes, and they just focus on the sick loved one, and sometimes that will stress themselves out. I remember specifically when my grandmother had just come home from the hospital, and we would go in to give her her food, and we learned that we had to be extra patient with her, because she was dealing with a very big change in her body. She was someone who was very active, always working, business owner, a businesswoman, my grandmother. And now she only had half of her body to function. Now she was a baby all over again. So that created a lot of anger inside of her. And we had to learn to be patient with her, because if we served her food that she didn't like, she would throw it around. She would have tantrums. She would kick things, you know, and we had to find a way to be patient, clean everything up, and bring her food again. It was a very intense
But
experience.
at least you guys have the tolerance. You guys has the patience, to understand her, because when someone used to do a lot, the way they used to live, and it's not only about vision. I've been talking about vision a lot, but if someone used to do everything they used to do, like you take your grandparent, I can use my mom. We don't want to do the mission, the whole show about this, but when someone used to do everything on their own, what happened to my mom in that situation, because she used to do everything, and when she come to United States, we try to prevent her do stuff she used to do. That's where she get upset, she get concentrated, she has high blood pressure, diabetic, and this is where she get a stroke. Now, and it's good you are able to understand that. We want everyone to watch the show tonight, and what Lady Nay said, she has the chance to understand her grandparent. She doesn't she doesn't get mad and gets stressed. You have to understand the situation, because there is different stage. When someone lost something in the body, either if they lost their arm, if they lost the feet, or if they lost their eye, or whatever the condition they have, they used to do, they cannot do it, or they used to drive, they cannot drive no more. That can bring them to depression. That can, some of them can even kill themselves. Now, you have to try to understand them, try to be patient with them, and try to see the best way you can walk, show them compassion. You can walk with them to the process, because I don't want to say you as a professional, but we know there is a lot of professionals that can help you work with this. Like most likely some of the social workers that specialize in this type of thing. You know, some of the geriatric doctor, you know, most likely we are glad at the present we have Dr. Theogen right now, even whatever his age is, he go back and do fellowship on geriatric. You know, he's a family physician, you know, to deal with old age people, because sometimes if you need advice, you know, you can get a counselor, you know, or to deal with your mom. And because sometimes I have patients coming in with their kids is claim, well, now I have blood pressure, I have diabetes, she make me upset, she doesn't want anything, she's doing it on purpose, but they don't understand, because their mom used to be able to see, to do a lot of things. And now she cannot do it no more. And in their mind, they can, sometimes they tell me their mom doesn't want to take the medicine no more. And she's yelling at everyone, because this is one of the stage. This is the time. These people we need you. They need you to be patient, to be there for them, because at the end of the day, you know, when this stage go over, you don't want to say that I regret it, you could do better.
Yeah.
Because me, I said that sometimes to myself, you know, I said, if I have the opportunity to, with my mom now, maybe I would do things differently, you know, stuff like that. But it was a learning experience, you know, stuff like that.
And this is exactly the reason why you need support. You need a support group of other people who are taking care of loved ones, other people who are family caregivers, because they can understand your situation, they can give you support, and you can let out some of your stories or your sadness or your feelings, and that will get you ready to go back in and take care of your loved one. So make sure that you take some time during this month. If you are a family caregiver, make sure you look for people who can give you support, give you advice, or give you just a listening ear. So on that note, we're going to take a short break, and we'll be right back.
Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous café sa famille. Oui, nous café sa amis. Oui, nous café sa famille. Oui, nous café ça.
C'est glauque comme fait nager. Ou ka traiter?
Oui, nous café sa famille. Oui, nous café ça. Nous café ouais.
Cataracte fait pas ka ouais pour sou ka traiter?
Nous café ça.
Depuis cycle la prend, m'pa ouais bénanger comme si pourtant tension j'aime toujours à monter descendre.
Café ça.
Nous capable pas gros côté opération moi qu'on y a là ou passer depuis vin la bon.
Oui, nous café
Reste dans poser. La journée moi depuis l'angélisme pas rien pour capter.
café ça. Nous café ouais.
Depuis au monde devant moi mosso pas un mosso.
Café ça.
Comme si tout bon nous capter.
Nous café ouais.
Eh ben nous même ça nous ici.
Nous café ça.
C'est vrai.
Nous café ouais.
Bon ça nous y est depuis m'vini là. Ma point.
Téléphone c'est 516 238 50.
Prince Center for the Visually Impaired is a state-of-the-art facility with low vision specialists for all your vision needs. Our low vision rehabilitation specialists will accurately measure your visual capabilities and help you use it and more efficiently. Please call us today for a low vision evaluation at area code 516-200-3850 or stop by our local office located at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Do not assume your options are limited to surgery or glasses, and do not wait until you are legally blind to benefit from our services.
Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly
Culture, société, politique, économie, santé, environnement, géopolitique, un franc-parler avec Ronald Léon, chaque mardi 7h, 8h PM sur le PCVI Network, Ronald Léon Show, le show le plus chaud du web.
Suivez-nous sur notre page Facebook, la chaîne YouTube et le site d'internet de PCVI Network. Enfin, sur la page Facebook de Ronald Léon Show.
And we're back on the PCVI network, and this is Healthy Vision. I'm your host, Lady Nay, and with me is also
Oh, you can say my name.
Dr. Prince. Thank you for being here tonight. And we've been talking about a lot of good things so far that are highlighted in the month of November. And they all kind of go hand in hand, you know. So we mentioned that it was Diabetes Awareness Month and COPD Awareness Month. We have Family Caregivers Month. All of those things are like encapsulated in November. We also have Healthy Skin Month.
Okay, that's for the woman.
Yes, it is very important because your skin is a reflection of what's going on the inside.
Well, you see, I said that, and
Yeah.
our technician today, he's looking at me. What do you mean, woman month? Men doesn't take care of the skin?
Okay, that's a good question. You know, there are a lot of men that like to make sure that when they shave or, you know, when they finish coming out the shower, they take care of themselves. And you know what? You touch on a very important thing. Sometimes people think that only women want to look good. Don't men want to look good too?
I guess, of course, me, I just those, most likely, you know, the way you walk in, you know, sometimes you may doesn't have time for yourself. But this month is a, you know, like you said, is a month where people take care of the skin. But a lot of business is going to make a lot of money. You're going to see a lot of, most likely the online business is promoted, the products, stuff like that. But everyone, you know, use this month if you have any type of a lesion in your skin, whatever you have, check with your dermatologist. Check with your doctor and see the best way you can take care of it instead of you try to take care of it for yourself. Don't wait until when you get something and that's not work for you and give you any bad reaction. This is when you're going to check with your doctor. This is the advice, you know, onto the network we can give you is whatever, if you like it, if it's any chemical product, if you don't use to it, you may be allergic to it, you know, it's best sometime you see your doctor, you know what you're allergic for. You can look at in the bottle, well, yes, I'm allergic to this thing. I'm allergic to this thing. This way, you know what you can buy.
And I have a very good friend of mine who has had different allergic reactions to different chemicals that are in the lotions and in the soaps and in the creams that she used to put on her skin. And because of this sensitivity, she said, no, I have to stop buying things from the store. I have to do some research. And when I find out what the best type of skincare for is for myself, she said, that's what I'm going to use. So she started to make her own lotion, her own soap, her own cream, her own body butters, even her own candles, everything for your home, for your health, cleaning products. And I think you'd want to have her on your show. I think you want to talk to her because, you know, a lot of these products have artificial chemicals and products that don't go well with your skin. Now, if you're someone who does not have sensitive skin, you're one of the lucky ones. But a lot of people now, they have to buy laundry detergent that has no fragrance, no color, no perfume in it. And so that is also a part of Healthy Skin Month.
Well, me, my position will be always, all, I would say, they always said you deal with old people, stuff like that. Is whatever what you're doing, make sure it's work for you, make sure, you know, what you're allergic for, what you're not allergic for, you know, stuff like that. And in PCVI Network, we have different shows. You know, on Wall and Leon show, we have a healthy aspect also.
Okay.
You know, a wellness aspect in the show. You know, and that give more platform than the Healthy Vision, stuff like that, where we focus. And then your show, Lady Day show in Africa also. You know, I know you said I can have it on my show, but you can have it on your show.
Most definitely, definitely, yes. There's room for everyone at the table. So earlier we were talking about Family Caregivers Month, but did you know that it's also National Home Care and Hospice Month in November? So you have the concentration on the family caregivers, and that goes hand in hand with home care and hospice. And you know, when someone is sick and they're at home, we do want to make sure that they're the most comfortable and the most well cared for. But from what I understand with hospice care, not going too deep into that, that is a concentration on really keeping people comfortable when they have severe diseases or terminal diseases or maybe deadly diseases. I was also informed that hospice doesn't mean that it's the end for you, although a lot of people, you know, get that type of care when they're in the advanced stages of certain diseases. But just because someone is in hospice, it doesn't mean that it's the end for them. Some people have actually come out of hospice and they've gone to normal, regular, healthy life. So I'm guessing that it's really about support and comfort care.
Yeah, Mosaki, exactly what you said. This is the month. We wish we will have one of the doctors that specialize in hospice care, and that might be in a better position that can talk about it. But for us, in a standpoint, what we can say, if you have anyone who have cancer or anyone who in the stage, late stage of illness, where the doctor said we cannot do anything for this person going to be die anytime soon. But no one control life. This is what you have to understand. Only God. Now, that doesn't mean the end of the world for this person, because a lot of people, when they heard the doctor say, we cannot do anything for you, you're going to die, they're already gone. Or some of their family member may already even not even thinking about them no more. This is the worst approach. Until the person, as soon as if the person is still living, you know, there's still hope. You know, the doctor, whatever the doctor may say, because me, as a low vision rehab specialist, I don't want to compare that with hospice, but I always say a lot of patients come in, the ophthalmologist said, I cannot do anything for you, going to be blind. I have a priest, pastor coming here and going crazy. The doctor said, I'm going to be blind. And when you look at them and you do what you bring them back in life, you know, take away the stress, and let them, these people is still living with their vision and everything better and better. And I can take one example. I have a lady, and I would say maybe like 6 or 7 months ago, she's one of the patients. When she has someone bring her here, when she came here and she could not speak, she said, doctor said she has cancer in a toe, and they cannot do anything because she could not speak. You understand? And they are going to put a trachea for her, stuff like that. And she said to me, when they said that to her, she said, doctor, I'm going to pray for you. Even me, I was advising her, you need to listen to your doctor. And the other day, you know, this lady came here. I even forget the way she came last time. When I said, yeah, I remember you could not speak. And she said, yeah, I talked to you about it. And she said, last time I went to my doctor, he keep asking me, what do you do? If he's asking me, what do you do? I say a lot of questions. Just to let everyone know, when you live in, there is always hope. You know, a lot of people may have some condition. The reason they get deteriorated is because the environment, the people, the support, they don't have, it's like there is the hand for them. That's why they're ready to go. No, if you're still living, there's still hope.
So our state of mind is very important. Okay, so thanks for advising us to always, you know, take a second opinion, or always keep hope alive, even though you get news that you wouldn't want to hear. There's no exact definition to say yes or no, good or bad. So we're going to take a short break, and we're going to come back and we're going to continue this interesting conversation on healthy vision. We'll be right back.
Okay.
Prince Center for the Visually Impaired is a state-of-the-art facility with low vision specialists for all your vision needs. Our low vision rehabilitation specialists will accurately measure your visual capabilities and help you use it more efficiently. Please call us today for a low vision evaluation at area code 516-200-3850, or stop by our local office located at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Do not assume your options are limited to surgery or glasses, and do not wait until you are legally blind to benefit from our services.
Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580.
Culture, société, politique, économie, santé, environnement, géopolitique, un franc-parler avec Ronald Léon, chaque mardi 7h-8h PM sur le PCVI Network. Ronald Léon Show, le show le plus chaud du web.
Suivez-nous sur notre page Facebook, la chaîne YouTube et le site d'internet de PCVI Network. Enfin, sur la page Facebook de Ronald Léon Show.
Mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous café sans famille. Oui, nous café sans amis. Oui, nous café sans famille. Oui, nous café sans.
C'est glauque comme fait manger. Ou qu'à
Oui, nous café sans famille. Oui, nous café sans. Nous café ouais.
Cataracte fait pas qu'à ouais pour ce qu'à
Nous café ça.
depuis cycle la prend pas ouais ménager comme si pourtant tension j'aime toujours à monter descendre.
Café ça.
Nous capables pas gros côté opération ouais qu'on y a là ou posséder pipi la peau.
Oui, nous café
Reste dans tout posé. La journée ouais depuis l'angélisme pas rien pour qu'arrêter.
café ça. Nous café ouais.
Depuis au monde devant moi mosso pas un mosso.
Café ça.
Comme si tout bon nous arrêter.
Nous café ouais.
Eh ben nous même ça nous ici.
Nous café ça.
C'est vrai.
Nous café ouais.
Bon ça nous y est depuis me venir là. Ma point.
Téléphone là, c'est 516 238 50.
We are back on the PCVI network, and you are watching Healthy Vision with me, your host, Lady Nay, and with Dr. Lucien Prince. And we've been talking about a lot of different things, and the producer said, let's get to the vision. So you know what? Let's do that, because this is really our field of expertise. And in November, we highlight Diabetic Eye Disease Awareness Month. So it's very important that we know that with diabetes, there are other things that come along with that disease, and your vision may be affected. It's not a guarantee, but it's a possibility that your vision may be affected.
Yeah, but most likely, I would say it's 70, research prove like 70-75%
Of people
of
with
people
diabetes.
has some form of vision loss.
Okay.
And they even said 40 or 45% of them doesn't even know if the vision is affected. That means this month is a month we're going to focus, because this November is eye disease, is diabetic eye disease month. We're going to, throughout the whole show, talking about this. Most likely, from time to time, we're going to be, because we are low vision rehab facility, most likely people that already have it, that if for any form of diabetic that complicated, we're going to talk to them. And people that already lost their vision, we're going to talk to them. And the people that doesn't have it yet, we're going to talk to them too. And we're going to try to see if we can get some other guests too, that that do diabetic. We already have one of patient that diabetic that already lost one eye, and she has one eye that left. That's two people of this show that give us a testimony already and stuff like that. And she said she doesn't want. She was a nurse, and she's still a nurse, but she's not working. She doesn't want what happened to her happen to anyone. That's why she said she wants to give a lot of testimony. She may ask me for 1 hour if she can have more time to talk.
Well, sister, there's room for you on Healthy Vision, and I can't wait to meet her. So when we talk about diabetic eye disease, there's some more specific names to that, to those type of diseases, right? So I'm reading right here that cataract is one of the diabetic eye diseases that can happen.
No. Well, cataract is a disease by itself.
Okay.
But when you have diabetes, you can have cataract
easier.
Easily. The same way you can have glaucoma easily, because everyone, the mechanism of diabetic, when you have diabetic, most likely the blood cell is affected, and as you know, in cataract situation, is the lens you have that's opacified, and what happened? The lenses make up protein and liquid and water, and because when you have a diabetic, the blood sugar most likely is affecting the circulation. It may create a situation where the protein can melt into the water and create a opacification of the lens, what we call a cloudy aspect of the lens.
Foggy type of view.
That's why a lot of patients that look at who are diabetic now, you may see your doctor, a lot of them may already have cataract surgery. A lot of them may see the doctor already said they have a cataract, but I always advise this way, a lot of this patient, the best thing for you to do is make sure your blood sugar is controlled.
Okay, so thanks for clearing that up.
Yeah.
So cataract is not a diabetic eye disease, but you're saying that if you have diabetes, then it makes it easier for you to get cataract.
Yes.
And some people can get cataract even if they don't have diabetes.
Yes, because that's why we say cataract is a disease by himself, because when, all of us, some form or not, when we're born, or the way our lens is so clear, we can even see our face on the lenses. That's why light goes so easy that we can see. But as we get old, with exposure to the sun, to the UV light, to blue light, computer, cell phone, and the lens is changing, and with age, a lot of change, because a lot of us, at some point with our age, we have some form of cataract going on. Some people get lucky, they don't have it, you understand? But some people even born with it, you know, because we are not focused on cataract today, because it's like, since you asked me the question, I can I just go in detail to explain a lot of us, you know, when you have diabetic, there is a lot of things that can happen. It's not like you can have, when you call diabetic eye disease, this is what we call the retinopathy diabetic.
Okay.
Why they call that retinopathy diabetic? Because when the blood circulation is affected, the problem most likely is in the back of the eye, in the structure that called the retina. And now, because that structure is mostly affected, in most people with diabetes, this is where in that part of the eye that mostly affected. That's why you have retinal specialists. Like us at the Print Center, we deal a lot with the retinal specialists, because it's just like we work together, we're like partner, because after someone having so many injections, if nothing work after several surgery, the retinal specialist always send it to us and to rehabilitate the little vision that left. You know, for people that get lucky, it's all to say to everyone that's watching this show now. You know, if your doctor said you're diabetic, they already have so many surgery where they cannot do anything for you, ask them to send you to the vision rehab. You know, because don't get stick in your mind there is nothing that can be done. You still can get back in life.
Okay, thank you so much. So this low vision specialty field, you know, you're the first low vision specialist that I've ever met, that I've ever known of. I really didn't know that this was a field of expertise that a lot of people practice. Is it a common thing, or?
Of course.
Are you the only one?
But I would say in the Asian community, I'm the first low vision rehab specialist. When I take low vision rehab, because I'm a vision rehabilitation specialist, and what that means, they call it vision rehab teaching also, because you have to study, you know, for that. And we rehabilitate eye, help people with the little vision they have, let them adapt with specific situation. We teach them cue, we teach them adaptation, we teach them visual skill. But in low vision rehab, you know, with low vision rehab is this one, the doctor may prescribe them any glasses, any type of lenses, stuff like that. The person may say the glasses doesn't work. It's not because it doesn't work. It's because these people, the glasses they give them, they don't know how to see on them, because they have to, when you lost your vision, you have to learn to see again. And this thing take time. You understand? Because some people, this is where I get a lot of those patients that went to see all the low vision specialists already. When they come to a Print Center, they said, well, I have so many glasses, this one doesn't work, this one doesn't do. And when you look at the glass has the correct prescription. The only thing the person doesn't know where the vision is. Because this part, the rehab aspect. That's why it took me time to even this week to explain to the doctor, because the doctor coming to me, he said to me, I just want to buy a handheld magnifier. And when I look at it, he only have one eye, just a little bit left. He said, well, when he look at the handheld magnifier, I said, you know, when he explained to me, I said, if you don't mind, you can explain to me what's going on. When he explained to me what's going on, and I said to him, we can help you. And he said to us, how? I said, you know what? You try to do a lot on your own. He said to me, well, I'm already, if I have an handheld magnifier that can make me do a little bit, that's okay. That's enough for me. I said, but you can do more.
Because he didn't know that was possible.
He didn't even know, but this is a cardiologist, the medical doctor. You understand?
But he's not a low vision specialist.
But he being sees ophthalmologist, he said, my doctor never talked to me about this. You know, this is what we're doing now, because, but the reason you don't hear a lot about vision rehab, low vision, because there is not a lot of university about that. There is a few, but there is a few. In New York City, I know there is one, but there is no low vision in New York City. As far as low vision, I know in Philadelphia, Salus University, and there is one in Massachusetts, UMass, and in Alabama. And the one in Alabama University, it's not open to everyone.
Wow.
It's closed only for the OT.
Okay.
You know, And you may see, or the doctor or the optometrist decide to just do low vision like this, but it's different. I know you're looking at me.
Well, you know, I really appreciate this conversation that we had tonight. And the funny thing is we didn't even touch on everything that November concentrates on. But we do have a lot more that we have to cover in the coming shows. And I really look forward to asking you questions, learning more, and sharing what I know with you.
Okay. Well, that's
All right.
good so far. And I hope a lot of people did learn a little bit. We talk about everything. But we're going to have more coming in the next show because the whole November will be a lot. And we can see Lady know a lot.
So thank you so much, audience, for being with us tonight. We hope you learned something new. And we'll see you next time on the PCVI Network. Tune in to Healthy Vision, and good night.
Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitez
Oui, nous café sans famille. Oui, nous café sans amis. Oui, nous café sans famille. Oui, nous café sans.
c'est glauque comme fait manger. Ou ka tete?
Oui, nous café sans famille. Oui, nous café sans. Nous café ouais.
Cataracte fait m'pa ka ouais kon sou ka tete?
Nous café ça.
Depuis cycle la prend, m'pa ouais ménager comme si ou tout. Tension chaîne toujours à monter descendre.
Café ça.
Nous capables? Pas gros côté opération mouais. Qu'on y a là ou posséder depuis la bon.
Oui, nous café
Reste
ça.
dans tout posé. La journée mouais. Depuis l'angélisme pas rien. Ou ka tete?
Café ça. Nous café ouais.
Depuis au monde devant moi, mosso m'pa un mosso.
Café ça.
Comme si tout bon nous ka tete?
Nous café ouais.
Eh ben nous même ça nous est ici.
Nous café ça.
C'est vrai?
Nous café ouais.
Bon, ça nous y est depuis m'vini là. Ma point?
Téléphone, c'est 516 238 50.